super excited to introduce Dr. Rima Haber, who's one of our amazing environmental health experts at USC and has been deeply engaged. She's what we call a faculty affiliate of spatial sciences, which means her primary appointment is over at the Keck School of Medicine, but she does a lot of research with us and works with our students. And she's got some really interesting stuff to tell us about kind of how geospatial knowledge and techniques play a key role in public health. So take it away. Thank you very much, Dr. Haber.
Thank you very much, Dr. Voss, for that introduction. Thank you for the invitation to be here today. I'm excited to talk to you all a little bit about how we use GIS and geospatial methods and spatial thinking in our environmental health research at USC. Today's examples will be mainly around racial and ethnic disparities in light of the COVID-19 pandemic, but obviously these questions transcend the entire environmental health field. And so this might be obvious to maybe this audience, but I just want to emphasize how important and fundamental GIS, geospatial science, spatial thinking really is for environmental health research. So when we're doing environmental health, we're really trying to think of how do humans get exposed to environmental contaminants of potential concern in the environment and how that affects their health. And obviously location is a crucial piece of that puzzle. And so the way we can understand spatial relationships and patterns and connections in terms of how all these environmental exposures, whether they're chemical or physical, sort of interact to affect human health is central in everything we do. And so some of the most pressing issues of our time, for example, really require this sophisticated level of understanding of spatial thinking. That includes climate change, pandemics, disaster response, as Dr. Voss was saying earlier, air pollution, built environment, etc. Next slide, please. Thank you. So when we talk about disparities, what are we really talking about? It's fundamentally about equity. And the term double jeopardy is used a lot in environmental health disparities research. It's meant to basically illustrate or highlight the concept that certain groups of people or certain subpopulations are very heavily disproportionately exposed to adverse environmental exposures. And at the same time, they are also at higher susceptibility, or they're more vulnerable to their effects. And so that puts them at a double jeopardy. And often these risk factors tend to fall along racial and ethnic lines, usually as a result of, let's say, decades of unfair or unjust zoning and housing policies and environmental policies. Next, please. Thank you. So this is an example from the Los Angeles area from Southern California. These disparities or these issues tend to basically result in very strong spatial patterning in some of the environmental and social risk factors or determinants of health that we think about. So if you look at that top panel there, that shows you the racial and ethnic breakdown. This is at the census block group level from the ACS data. And if you look at the panel underneath that, it shows you how some of the social factors, let's say like poverty or rent burden or educational attainment, really fall along those kind of lines of racial and ethnic breakdowns, right? Next slide, please. And so in California, Latinx, Hispanic, and Black communities really bear the largest burden. And so about 1 in 3 Hispanics tend to live in the 20 most impacted census tracts. And I'll tell you impacted in one way in a bit. About 1 in 4 African Americans, and compared to 1 in 14 whites. And on the right-hand side there, you see, for example, for childhood obesity rates, Hispanics are also at a very much higher increased risk. And those rates are much higher than all the other racial and ethnic groups. Next slide, please. So this motivated our work in the Madre Center and really was the stimulus behind kind of setting up and launching this center. Madre stands for Maternal and Developmental Risks from Environmental and Social Stressors. It's a center of excellence for environmental health disparities research. We are really focused on trying to understand how adverse environmental exposures and social stressors together combine to affect pregnant women's health, but also their infants or the newborns' health, and especially in a predominantly Hispanic population in Los Angeles. So the center is led by doctors Carrie Breton and Tracy Bastain, also faculty in environmental health. I lead the exposure assessment components and a specific project that I'll talk to you all about in a bit. Next slide, please. But really what we're doing in the center is we're recruiting a pregnancy cohort of about 1,000 women from Los Angeles, California. And so the map on the left here shows you what is called Cal EnviroScreen. Some of you might have heard about this data tool, but basically it's an environmental justice screening tool where you see the kind of the red colors are highlighting census tracts within, again, this is Los Angeles and Southern California, that are most impacted or most burdened by both adverse environmental exposures, but also susceptibility factors in the population. So the map on the right there shows you, it's a little bit dated, but shows you most of our participants' residences in Madres, and more than 60% of them actually live in one of the 10% most burdened communities in California. And that's shown by the blue and purple dots there. Next slide, please. And so to show you some data on our Madres population, these women are again predominantly Hispanic, followed by Black, some college degree or lower for the majority of their educational attainment levels. These are individual level data, mainly a low income cohort, and also a very highly employed population of pregnant women, either as formal jobs or as homemakers, basically. Next slide, please. And so I'm going to show you some maps, again, to highlight sort of the importance of spatial information in communicating, but also in telling you more about our cohort. So this is, again, Los Angeles, and you see the dots on the map there are the clinics we are recruiting this pregnancy cohort from. And so the darker pink to purple colors indicate the neighborhoods where we have the highest recruitment. So most of our participants actually live in South Central, South LA to East LA. Next slide, please. And if we look at, again, the racial and ethnic distribution in those neighborhoods, so the Madres neighborhoods are highlighted in that pink outline. The green color are neighborhoods that are predominantly Hispanic, and the yellow are predominantly African-American communities. Next, please. If we look at the total environmental exposure score from the Cal EnviroScreen tool that we presented, and so this is representing basically a score of the highest adverse environmental exposure burden. So things like air pollution, traffic, diesel pollution, contaminated water, maybe pesticides, even though not applicable for this urban area. We also see that our Madres neighborhoods live in the zones that are basically shown in the darkest brown color with the highest environmental burdens. Next slide, please. And similarly, when we think about susceptibility factors or things that like unemployment or housing burden or poverty or even linguistic isolation, we also see that our Madres neighborhoods are very much in that area with the highest susceptibility factors. Next, please. And so when COVID-19, the pandemic obviously started earlier in the year, we very quickly started to notice, and not just us, obviously the media, all the public health agencies, that again, similar with a lot of environmental health issues, certain subgroups, usually racial and ethnic subgroups, are more heavily impacted by COVID-19. So we thought we needed a way to basically communicate around these issues in our population for a variety of audiences. And again, because of the the importance of all these spatial relationships and risk factors, we thought of building a story map. And this story map is available online. You can just Google Madres and COVID-19 story map and you'll find it. And all the pictures I was showing you before come from that map. But basically we wanted to do a deeper dive to see whether these same risk factors and adverse exposures and susceptibility factors are really leading to the highest COVID-19 rates in the same Madre's neighborhoods. Next slide, please. And so this is just a very telling front page of the New York Times article from earlier in the pandemic, actually, showing again that for Latinos and COVID-19, there's an alarming health disparity. And I just want to say that this article was based on one of our former students' work in Portland, Oregon, who we're very proud of, but just to show you how kind of directly relevant and important these skills are that you're learning these days to really go out there and be on the forefront of public health and geospatial training. Next slide, please. And so when we started to look at the data of COVID-19 case counts, and this is just the number of cases, admittedly, this is a slightly dated map, but again, you can see it online. We also began to notice that the highest counts are also within the same Madre's neighborhoods that experience all these other disparities. Next slide, please. And also you might be thinking as a spatial expert or analyst, let's say that, well, maybe I want to look at a standardized measure. So what if I consider population into that number? And if we look at the case rates for COVID-19, again, we see in the darkest blue colors there, there's a lot of overlap with Madre's neighborhoods and where the highest COVID case rates are occurring. And we've actually had to change that color scale several times over the pandemic because of how kind of quickly those rates were increasing over time. Next slide, please. And probably earlier on, but also still relevant, the pandemic has really highlighted how built environment factors and urban design factors come into play in terms of trying to basically help us limit the transmission of COVID-19 or potentially exacerbating or accelerating transmission. So one of those factors that we were looking at is housing density and how that, again, seems to overlap, at least when you look at it visually in space, with the highest counts of COVID-19. Next slide, please. So just to share with you all some of our very preliminary COVID-19 survey results from our population. So these are individual level data, courtesy of Drs. Bastain and Breton. And about 74% of our participants have reported losing or at least suffering a reduction in one person's income in their household. They've also reported increased feelings of discrimination and feelings of social isolation, which of course are psychosocial stressors that could have an impact on their health. 46% of them reported that either their job or their partner's job puts them directly at increased risk for COVID-19. And what that says is that really the majority of these women's or their partners' kind of jobs are deemed essential workers. And that again means that they don't have the luxury, let's say, to work from home, and they are increasingly concerned about getting exposed to their jobs. And then finally, the majority of them are reporting lower physical exercise and maybe eating more to cope with stress. Next slide, please. So just to show you sort of some of the work we do in community outreach, and this is the work of Dr. Jill Johnston and her team. We've designed COVID-19 infographics to try to communicate around some of these issues. And so, especially for example, household crowding, and if you have several people living in your home, and maybe some of them are essential workers, how might you manage your household in terms of cleaning practices or kind of isolating areas if you are concerned about COVID-19. Next slide, please. Finally, I'm going to wrap up with giving you a sense of the general direction we're going in our second cycle, which actually just started and will go on for 5 years. And then I'll show you some of the other approaches we also use on top of, let's say, spatial temporal GIS analysis. And so in our second cycle, we are really going to be taking a very kind of global overview of a variety of environmental exposures that occur during the pregnancy period. So really characterizing the prenatal environment in terms of air pollution exposure, in terms of residential mobility. So when might these women and their families move residences? And is that for, let's say, you know, adverse or stressful events, or to basically get an improvement in their life? What does that do to their exposures? We're also going to be looking at the built environment, factors like walkability or access to healthy food options or access to parks, and psychosocial stressors, and how all that affects postpartum maternal health risk in terms of depression and mental health, but also cardiovascular disease. And so a big focus of our center for the next 5 years will also be on understanding the biological pathways, or the how, or the mechanisms of how do these exposures in the pregnancy period end up affecting the mother's health in the postpartum period. And that's really going to be the focus of my project in the middle there. Next slide, please. And just to illustrate for you in a little bit more detail, I will be looking at postpartum allostatic load, which is basically a composite metric of functioning, let's say, along several different organ systems. And so we're going to be looking at a collection, or the totality of neighborhood exposures along the built environment, physical environment, things like urban heat island, noise, the chemical environment, and social stressors, and how all these together interact to affect postpartum allostatic load, which actually in and of itself really predicts later life health outcomes as well. Next slide, please. And so this is one of my last examples along sort of GIS and spatial methods, just to show you from our earlier work. This is again preliminary, back when we had about 400 participants in the study, and we have now about 950 or so. So the map on the right shows you homes of our Madre's participants, and we conducted what's called a clustering analysis, or a multivariate dimension reduction, where we assessed all these hundreds, really 94 environmental and social factors. So built environment exposures, chemical exposures, physical exposures in the neighborhood, as well as social stressors. And what we did was we tried a clustering analysis to basically distinguish groupings or patterns in how these exposures occur together within our neighborhoods, you know, in a way that basically identifies them in the most distinct way possible. So for example, if you look at those green and blue dots, those are what we're calling our near toxics in blue and food desert neighborhoods. And those are very similar in terms of socioeconomic characteristics. So these are neighborhoods with a lot of poverty, with unemployment, with maybe crowded housing. But the way they're different is more on the built environment and chemical exposure side. So the blue dots are what we're calling near toxics. They're much closer to hazardous use facilities, industries, whereas the green dots are distinguished from those blue dots by the fact that they are more of a food desert. So they lack kind of healthy options for food, and a few other clusters that we've also identified. So this is just an example of how we use these methods to address these kinds of questions. Next slide, please. And I want to spend the last about 5 minutes, I think, of my talk showing you sort of the micro spectrum end of things, where on top of GIS and spatial analysis and maybe this large scale spatial temporal modeling, we also use sensor-based approaches to assess environmental exposures and how these pregnant women get exposed to them in relation to how they're moving around in the environment, so their mobility patterns. So in several what we call sub-studies in Madres, I'm doing very personalized monitoring of air pollution specifically, and also GPS to understand these things. Next slide, please. So this is just an example of some of the tools that we might use. On the left-hand side there, you see the RTI MicroPEM, which is an air pollution monitor that we designed basically to be held in a purse that the women can wear. And so it'll be measuring the air pollution that they are breathing in their breathing zone on their person. And that allows us to collect 1 minute level air pollution particulates matter concentrations. We've also designed our own Madre's GPS app to allow us to basically collect very highly resolved GPS data and metadata on smartphones. And so we deploy these along with some surveys on the smartphone to really understand, let's say, physical activity and stress outcomes and context. And we might use also some other methods like the one you see on the right, where we might deploy a filter in the setup to collect additional data and allow us to look at basically chemical composition of the air pollution. Next slide, please. But just to show you kind of the very rich geospatial information we get from this. So on the left here, you see a map of the very highly spatial temporally resolved GPS data that we collected. So this is 10-second level data on about 60 women monitored across pregnancy for about 12 days each. And just by kind of integrating and analyzing some of the metadata like velocity, and on the right there, you see, let's say, frequency or duration of time spent in these different locations, we can start to understand or tease apart these women's time activity patterns. Where are they spending the most time? How often are they moving around? And where are they getting the highest exposures? And if that is changing, of course, across pregnancy and might be potentially a reason for concern for the health of the baby or the mom. So next slide, please. I think I'm about to wrap up, but I just wanted to illustrate two examples from two of your amazing colleagues in the Population Health and Place PhD program. And so Li Yi on the left here is basically developing methods to analyze this kind of GPS data to really understand trips and stays and context around these mobility patterns. And Yan Shu on the right here is really developing methods to basically be able to integrate environmental exposure data along where the participants have actually spent most of their time in their GPS tracks, and to show basically how these are very much improved methods compared to the usual, let's say, residential or neighborhood approach. And next slide, please. And I think this is my wrap-up slide, just to give you an overview of some of the many ways that you could potentially get involved in the Madre Center and in our environmental health research, once you've been enrolled, of course. The pictures are our entire investigative team. Again, Carrie Breton and Tracy Bastain lead the center. And we have wonderful investigators who are also kind of central in this effort, Dr. Farzan, Dr. Toledo Corral, and Dr. Johnston. So once you've been enrolled, you could potentially be matched up with mentors based on your interests and availability. Projects can range from sort of literature reviews to helping with data collection or analysis or writing up manuscripts. We do offer some volunteer or internship opportunities. It really depends on availability, and mostly with sort of community outreach aspects that are led by Dr. Jill Johnston. But also, even if, let's say, the topic doesn't match within Madres, within our environmental health family, there are definitely lots of exciting topics to be involved in. So please do reach out at any point and we'll be happy to assist you. So with that, thank you very much for your attention. And I think I'm turning it over to Dr. Voss.